This young man had a habit of frequently cleaning his ears with cotton swabs. But strangely, the more he cleaned his ears, the itchier they became. So, he came to see me for an examination. During the endoscopic examination, I found a layer of impacted earwax covering the skin of his ear canal. The more you irritate the ear canal with cotton swabs, the more the skin can become inflamed and produce moisture and earwax. Over time, this material can dry out and stick firmly to the ear canal, causing even more itching, creating a cycle of the more you clean, the more you itch. Under endoscopic guidance, I gently separated the layer of earwax from the skin of the ear canal using specialized instruments. As the buildup was gradually removed, the ear canal became clear again. You can actually see how relaxed the patient feels as the ear is being cleaned. If your ears keep itching, don't keep using cotton swabs. They may make the problem worse. Let your ears clean themselves, and see an end specialist if the itching persists.